Hello everyone, good to see you all again. I am Zhang, private practitioner, periodontist. I welcome everyone to the Dentum Live Surgery Show. I appreciate all the people across the world for giving much attention to these monthly live surgery shows. With all your support, we are holding 2 live surgeries a month. I'm honored to join this live surgery as a moderator. Today, we have Dr. Zhang with us. He is showing us the smart approach to sinus augmentation and removing technique of failed implant. Furthermore, he will introduce a new implant system. I hope this live surgery will upgrade your critical skill and your own practice. If you have any question, send us anytime during live surgery. It will be replied. Okay, thank you. Let's take a look at today's case. Okay, today's case, patient is 58 years old male patient. He already got the extraction of number 17 area on the May 20, 2020 this year. And he got a hypertension and a DM history. This one is intraoral, the panoramic view at the first visit of Well Dental Clinic, May 20, 2020 this year. So actually, as you can see, number 16 and number 17 tooth is so poorly periodontal condition, as you can see, and also number 25 area implant installed already got the rate, the peri-implantitis, as you can see, so a big bone defect already have. So another areas, number 37 area, also progressive rate failure, like due to peri-implantitis. This one is the October, the visit view. Number 17, second molar already extracted, and very nice, well healed site, as you can see, and also the same compared to at the first visit, as you can see, number 25 areas, big bone defect on around the already installed implant area. And number 37 also the bigger and bigger bone defect. And this one is just before, maybe this month, November 2nd. The patient got already this number 17 extracted, very nice, well healed, and number 25 failed implant already extracted, removed, and also number 37 area remove superstructure from the fixture body. But this fixture body is not so good, as you can see, so it is should be removed today's surgery. Okay, this one is CT scan. Number 17 area, as you can see, the remnant of bone, host bone, around 3-4 millimeter, so restricted, limited volume, bone volume. So these areas is necessary to sinus augmentation. Number 24 area, that already got a big defect. Number 25, this big defect, like actually this kind of defect called as a bump crater, big bone defect. So this kind of defect is very difficult to treat and handle. So need a big GBR procedure with flap management. So around number 26, already installed implant area, very nice, but this one should be removed because of the total treatment plan. So sometimes this kind of the already installed implant fixtures inhibit or inhibit some barrier for fully constructed implant-supported prosthesis. So sometimes stay there, sometimes should be removed. It depends on surgeon's treatment plan and the situation of this implant. So number 27 area, as you can see, a very thin layer. The maxillary sinus area may be around 2 or 3 millimeter of remnant bone, thickened mucous area. So this area also should be a sinus augmentation procedure. I think this area, lateral approach, is better than crestal. Number 37 area, as you can see, buccal bone defect around this already installed implant area, and also the lingual, the same. So this implant it is impossible to sustain this area, so also should be removed at the same time today's surgery. This one is initial photo. So the metal occlusion on the upper jaw, and the right upper is lower jaw, porcelain fused metal crown connect with implant fixture with this old-fashioned crown. So anyway, the big holes looks like here cause of a screw retriever hole, and as you can see, this 4 splinted unit implant supported superstructures is not good condition, cause of embrasure and some shapes, and the periodontal tissues, health of these periodontal tissues, and it is not good condition, so should be removed and check again and remove fixtures. Sometimes we have to treat this gingiva and underneath periodontal area. And this one is a 37 area, and also we can see the big hole on the occlusal table here. And yeah, the November 2nd, remove implant fixture, and lower photos shown you this the remove superstructure connect with abutment. So when we have today's surgery, Dr. Chung have some question. Around number 17 area, which one is better for a patient and treatment? Crestal approach is better or lateral approach for sinus augmentation? And around number 24 area, narrow implant is better or GBR procedure first for the delayed approach? So all of these area need some choosing condition. Either one, which one is better, we have to consider before starting surgery and before making a treatment plan. As you can see, all these areas need some the choosing and selection of treatment goal, like this one. So finally, Dr. Chung decided to treat about number 17. He is going to have a crestal approach for the sinus augmentation with the implant installation simultaneously. First of all, he wants to make a semilunar incision for maintain keratinized tissue, and simple sinus lifting using desk kit, and use a wide diameter 50 size diameter implant. I think this system will be a brand new system, bright system from the Dentium. Okay, let's see this similar case. This similar case is easier to understand for today's Dr. Zhang's live surgery. First, number 17 area, the same as today's surgery, the case. Make some small semilunar incision, minimal incision, and detachment, and drill, and implantation, and that's it. Connect with healing abutment, no suture. Yeah. So after healing stage, he connect with the scan abutment, and from this intraoral scanning, the milling, customized milling abutment, and with connect with the zirconia superstructure. Looks like here. What about number 20 area? Number 24, 25, 26, 27 area. What about this area? As you can see, number 24 area is available bone, is there, but not enough. So consider to this, the small volume of available bone. So he have decided the diameter to find 2.5, a smaller diameter, and the longer, around 9, maybe 10, 11 millimeter. Anyway, smaller diameter implant will be placed on this area, cause of maximize use this remnant of available bone. About 25 area, maybe he want to have bone grafting for the delayed approach. Just bone grafting with the GBR procedure, covered by membrane, and stay there. Maybe 4 to 6 months later, he is going to try implant installation. It means a delayed approach. What about number 26, 27 area? This area need the sinus augmentation. So Dr. Chung want to have a lateral approach. So using this DAS kit, and after lateral approach and sinus elevation, and the simultaneous implant installation will be done. So about number 37 area may be removed of failed fixture and then stay there. And 2-3 months later, he is going to try again new implant installation, exactly the same area for rehabilitation of failed area. So this one is another similar case. So can you see how can we remove this failed implant? There are many different kinds of techniques are there, right? Using some specific devices can be used for removing this failed implant, or some trephine drill can be used, or a surgical bar and elevation technique for the same as extraction of third molar, right? So there are many different kinds of technique to remove this failed implant. So this time Dr. Zhang is going to use trephine drill and the elevation technique. This specific technique will be shown to us. Okay, so after removing this failed fixture, and next step will be a GBR procedure, a bone augmentation, grafted bone, membrane, flap, and stay there. And we have to wait 4 to 6 months, and then after this waiting time, we can do another implant installation. Okay, so similar case 3 means if we have some arterial rupture, how can we manage this kind of situation, the actual emergent situation? If we have some the arterial rupture, squeeze with hemostat, this ruptured artery, and make some squeezing is a necessary part, and then we can do further procedure. Okay. Okay, so this one is the overcoming artery rupture case. Okay, let's move to a surgery room, operation room. Dr. Zhang is starting with the upper left molar area for sinus augmentation.
The bone
right?
condition would be better.
Okay.
So if you place the narrow diameter implant in the first premolars, the surgery will be very simplified. So I will try to make an incision, little bit palatal side, to make a much more keratinized tissue on the labial side. So I will start first incisions.
Dr. Zhang is explaining about his incision design.
Positioned.
The vertical incision on the number 27 area, and then make some semilunar incision for turning to crestal area.
Positioned to the distal side of the canine.
Okay. Until to canine area, he made the crestal approach, deviated to palatal, right? So from the mid-crestal, maybe around 2 millimeter deviated to palatal. Now he make a vertical incision on the line angle of canine tooth.
And to confirm the clear cut of the incisions, instead of the blade,
make a confirmation.
Blade side, I will use the
he preferred to use a back.
Times complete cut.
Back portion of scalpel.
Bones.
He don't use the blade of scalpel. Now he is using the back portion of scalpel. The cross-checking, the clear cut.
After that,
okay. Try to flap reflection. Yeah. The small round curette, big round curette, flap reflection was started. Okay, so yeah, then he wanna make a full thickness flap reflection from this the incision area, the crestal area. Okay, the granulation tissues around there. Okay. As I mentioned before, this distal part of canine have a big defect. Looks like here. Almost like a clip, the bony clip. So big defect around there, number 24 area.
3 days before we removed the implant.
3 days before. 3 days before, he already removed number 25 areas, already installed implant fixtures, removed. So the granulation tissues are still there. Now he removed all the granulation tissues around this big bone defect. Very big, huge defect here. A bomb crater, like bomb crater like big defect.
And also you must do a sinus elevation, approach to the labial side, and little bit raising the flap.
Yeah, he is going to have lateral approach for sinus augmentation. So full thickness flap reflected from this posterior maxillar area.
of the labial bone.
Okay.
여기 임플란트는 좋네요. 포지션 위에는 이게 좀 아깝네요.
Actually, another one.
Tried to initial drilling for the checking the position of the implant.
Now we have adapted the milled, the surgical stent. This surgical stent from the milling machine. This one is not 3D printed stent. This one is milled surgical stent. This one is stronger than 3D printing the stent. So even though this kind of tissue supported area, it is enough strong, so not deviated from top to apical portion during drilling. Okay, he is using the guide drill 7 mm length. Yeah.
Very narrow.
Very narrow. Wow.
In the major distal side.
It's too stiff. Yeah, like a clip.
Premolar area with a narrow diameter implant.
So, due to this situation, he had a plan about narrow diameter implant on number 24 area. Okay, so
for the very narrow diameter implant, I'll do a little bit repositioning with the different with the surgical stent, and on this side with a very narrow one.
Yeah, narrow diameter, narrow reach. It is not the bone volume is not sufficient. So he make initial point with a free hand. So using this first drill, make a point first, and then maybe he
고개를 좀만 더
yeah. He is going to have a modified drilling technique, right? So
본이 좋으신 것 같아요.
yeah, bone.
예, 그러면은 3.5에 9를 할까요?
Okay, so now he had a check bone quality and position.
Relationships. 다 물어보세요, 선생님.
Okay, checking the path and relation of both jaw.
약간 뒤로 당기는 건 어떤가요? 그럼 3.5에 9로. 예.
Okay, so maybe the modified drilling means slower. Like a slower RPM looks like here. So lower RPM, and this bone osteotomy site automatically move to distally, right? So it means the modified drilling technique on this kind of not enough tight, tough, developable bone situation.
The diameter is 3.0.
Okay, so now his implant, the installed implant, 3.0. Yeah, 3.0 implant picture. It is difficult to have fixation.
Yes.
Oh, initial stability.
A little bit collapsed.
Okay.
다시 한번 더 try.
Then you want to try again. Yeah.
Fixture adapter가 이거. Fixture adapter. 요거는
Okay, now he is using the bright, the tissue level implant, the NTI type, tissue level implant. This tissue level implant, the stronger than the same size as a bone level implant. It means the same as 4.0 diameter. For example, NTI tissue level implant is stronger than the bone level implant. So this kind of narrow reach, when you have implant installation, this kind of narrow reach, you can use a tissue level implant instead of bone level implant because of this smaller diameter of tissue level implant, same as the one size bigger, maybe one size bigger diameter of bone level system. So now Dr. Zhang want to use this NTI tissue level implant. So he is going to try again. Okay, good. Okay, then anyway, engage the bone. This bright system have a good, give us a good enough. Okay. Yeah, it is not enough to initial.
Bone condition is very poor, so very
Yeah.
difficult to place.
Yeah, cause of this the bone crater-like big defect. So even though the smaller, the narrow diameter like 2.5 or 3.0 diameter is impossible to get the initial stability on the proper the placement point. Okay.
좀 연조직을 다 제거할까?
Okay. So now he's changing his mind. So okay.
Front with the treatment friend.
Uh-huh.
And so very difficult to place the implant.
Okay.
움직이지 마세요, 선생님. 아프시지 않죠? 움직이지 마세요. 좀 울립니다.
Okay. So remove all the granulation, the soft tissues.
세데이션은 몇 개세요? 네? 했어요? 네, 이렇게 긴장을 많이 하시죠?
Okay. So the patient have a nervous situation here now. Cause of all the patient scaled dental clinic, all the patients scaled dental clinic, and all the patients scaled surgery. So this patient, even though the relative, okay, Dr. Zhang need more the injection.
지금 아프세요?
Okay.
최대한 여기 돌려보세요. 조금만 더.
Then he changed a smaller diameter of carbide bar for removing all the granulation tissues on the
좀 아프세요? 잠깐만.
crater-like defect.
약간 감각 있으세요? 예, 마취를 충분히 앰플 하나 더 쓸게요.
Okay, so I think
그렇게 많이 아픈 상태는 아니거든요. 예, 그냥 웬만하면 그냥 참으세요.
I think he should skip this number 24 area for implant placement because of due to big defect. It is impossible to get the initial stability. So I think he should skip placement of number 24 area.
고개로 이렇게 돌려보세요.
Okay, remove. Try again. Removing the granulation tissues and surface bone. These procedures gave us another advantages. First, removing all the soft tissues attached with bone surface, and number two, surface activation can be achieved using this gliding or with small diameter carbide bar. Grinding the surface of bone means surface activation. So surface activation means accelerate new bone formation when we have bone augmentation, some bone grafting. So he is going to make a lateral window for lateral approach of sinus augmentation, sinus elevation, using this black one, the sinus drill. This one is better efficiency compared to the standard type of dust kit, the yellow one round bar. It means this black one, the contact surface is bigger when we have grinding on this lateral wall of sinus area, right? Okay. Okay, he make a lateral window here.
저 있는 쪽으로 고개 돌려보세요.
Okay, better efficiency, the reduction efficiency, better reduction efficiency compared to yellow one. Yellow one means original, the standard dust drill on the dust of the dust kit, right? So this one is larger contact surface to bone, larger surface of roughness. So it is better than the yellow one when we have this kind of difficulty of accessibility. Sinus augmentation procedure. Okay, so he used elephant foot. This small dome-shaped instrument, another nickname, elephant foot. This one is very efficient and useful devices, as you know. So when you're using this elephant foot, okay. Okay, detach of a sinus membrane from the lateral wall, and easy to make easy to the separating procedure, the sinus membrane from the lateral wall. Okay, he changed to another instrument for detachment of sinus membrane. Okay, so finally he is going to use long bow. Long bow is another nickname of this kind of instrument. Oh, he can find the septum now around this area. Okay. He can have a septum. Okay, he had a septum here with a tactile sense. So, okay. Okay. So detachment already done. A very faster membrane detachment from the lateral wall. When you have a lateral approach, you should choose two essential instruments. First one is elephant foot. Another one is long bow. Elephant foot is when you make a lateral window, and then you can use this elephant foot detachment of sinus membrane from the lateral wall. Now he put the osteon 3 collagen alloplastic graft material put into the sinus cavity. Okay, osteon 3 collagen graft materials.
So we do elevated minimums. And also we'll to place the short implant, the length will be 7 millimeters, but the width around width will be also 5 millimeters, very wide and short implant will placed.
Okay, so
이 정도로 될 것 같아요.
yeah, Austrian 3 collagen, palette type, Austrian 3 collagen.
여기도 어떻게 할지 고개를 조금만 더 돌려보시겠습니까? 여기 진입하기가 쉽지 않네요.
Put the Austrian 3 collagen into the cavities already made after sinus membrane elevated. And okay. Okay, thank you for your good comment by Dr. Ong Chi Shin. Thank you very much. And another Dr. Zebi. Thank you very much joining us tonight. Okay, so after sinus membrane elevation, put Austrian 3 graft material, put inside, and then move to anterior area, number 24, a big defect, the bumming crater-like big defect. Okay, so yeah, he grind out all the surface area okay, now he used a laser, yeah, a laser. Using these lasers gave us big advantages, maybe decontamination around these areas actually failed implant located area, right? So Dr. Zhang is trying to all decontamination of all these the area. First, removing all soft tissue granulation tissues, and then apply this laser at this area. Okay, so
냄새가 나시죠? 타는 냄새가요?
okay, start again. Use this black one, big round bar, diamond round bar. Actually, this one is, as you know, the sinus drea for removing the lateral wall for lateral approach. Okay. Okay, then he wanna try again. This number 24 area, slightly move to palatal area, right? So. Okay. Okay, thank you for joining Dr. Singh and Dr. Zebi.
Intramural penetration
Okay. Now he make intramural penetration using this the Fisher bar, high-speed Fisher bar.
For bone breathing, I will try to intramural penetration.
Yeah, intramural penetration using this high-speed Fisher bar. Promote newborn formation. Intramural penetration gave us advantages to promote newborn formation when you have a GBR procedure like a big defect. Okay. So once again. Okay, now he is preparing for implant installation. On
bone is
24
very
area?
wide, it's
Okay.
buccolingually, so I will
Okay,
try to
number 24 area, that he is going to try again,
lateral side.
slightly move to palatally and make osteotomy with Lindemann drill. This Lindemann drill is essential for make osteotomy, right? Okay.
이쪽으로 이렇게. 본 레벨을 3.0이 있죠. 네, 2번으로 해서 미안해요.
Okay, many doctors from around the world is joining to this Dentium Live Surgery show now. Dr. Eda,
3.5에
Dr. Mokovina,
캐나하고 관계 때문에
Dr. Svetiana, thank you for joining.
아이고 그러니까 거의 9mm 줄까요? 3.5 9mm. I will change it in the bone level implant.
Oh, the very famous,
어렵게 됐네요.
very famous professor, Dr. Zhang Park, is also gave us a good comment. Thank you very much, Professor Park. Professor Park is like a celeb in our the Korean dental field in dentistry. It looks like a celeb, the professor. So anyway, the 3.5 and 9 millimeter bone level implant placed on this number 24 area. He make a little bit deep insertion cause of
교수님 그래도 잘 들어갔네요.
yeah,
쇼스예요.
cause of initial stability.
The implant position is a little bit deeply placed, so instead of the cover screw, I will try to place the healing abutment.
Healing abutment connect with the installed fixture.
오스틴 3를 좀 할까? 콜라겐 멤브레인 여기부터.
Then sometimes the same as me actually.
요 38 힐링이 맞는 거죠?
Sometimes this healing abutment
아니 이게 다 안 잠겨서 어디 걸리나 봐.
gave us the better initial stability instead of cover screw. So sometimes Dr. Zhang used this healing abutment connection instead of cover screw. Changing the cover screw. So he tried healing abutment, but it is impossible to full connection. So he is going to change, use a cover screw. I want to say something about the healing abutment. When you have a little bit lower initial stability, when you have a softer bone implant installation, sometimes healing abutment connection, even though it is not enough higher insertion torque, it is better. It is the better situation. It is gave us a this one is gave a better situation cause of this healing abutment contact to bone surface directly. Also, this effect means the help to the implant picture stability, right? I means when we have some stiff area or a slope area, bone sloped area implant installation case, instead of cover screw, when we use healing abutment, smaller diameter and slightly the higher length of healing abutment, help the implant fixation, cause of contact to the sloped bone. Right? So sometimes I prefer to use healing abutment instead of a cover screw, even though a little bit lower insertion in torque. Okay, so the bone graft materials applied on this big defect, osteon 3, alloplastic bone graft materials applied on this big defect.
멤브레인을 일단 고정을 할까? 예, 그렇게 좋습니다.
That you want to try to fix
이렇게
the membrane over the grafted area. Okay, now he is checking the palatal area. I think this kind of defect situation, maybe partly tugging of membrane is better, and on level, maybe using pin or some other devices available. Someone use periosteal releasing incision and then periosteal suture for fixation of membrane. This kind of type is popular, and the standard actually for fixation of membrane. But now, Dr. Zhang is trying to use the pin instead of periosteal holding suture. Okay, a 2.5 millimeter pin used. First one, and then try again. Try one more. The mesial part of membrane. Okay.
메탈인가? 메탈 같죠? 아이고 어렵다. 고개 저 있는 쪽으로 좀 더 돌려보시겠어요? 좀 더 큰 걸 쓸까요? 고정이 멤브레인이 작으니까.
Yeah, hello, Dr. Christopher Sim. Thank you for joining this live surgery show. Dr. Christopher Sim is a key opinion leader of Singapore. So, thank you very much for joining us.
이 정도로 하고 7번 부위의 임플란트도 신입해 놓고 할 걸 그랬나? 네, 7번 부위 임플란트 신입을 할까요?
Okay, so as I mentioned before, the palatal site tugging technique between the bone and the periosteum. This membrane can be tugged between bone surface and the periosteum. So the membrane pin was used for to fix the labial part of the membrane. And now it's going to try another implant fixation. Okay, using this surgical stent, number 27 area, starting to drill to fix implant. Okay, so The fixture diameter 5.0, length 7. This one is brand new system, Bright system. The Bright brand new system from Dentium company is bone level, both available bone level and tissue level. This one is bone level, as you can see. So this Bright system have both bone level and tissue level implant system. This Bright implant, bone level Bright implant, is very unique. A different connection compared to supine. A supine is Astra type connection, right? 11 degree, but this Bright connection degree is 10 degree. 10 is Dentium style, Dentium type, right? ITI family have 8 degree, Astra family 11, Dentium family have a 10 degree. Okay, 10 degrees internal connection bone level implant of Bright, a brand new system, gave us a stronger connection between implant fixture and abutment. It means very important part, as you know, when we have a posterior portion of implant replacement for occlusal loading, as you know. So connection is an important part, important factor for longevity of implant, as you know. So this 10 degree connection is unique of Dentium. So they launched it as a brand new system, the Bright system. So another one unique the character of this Bright bone level implant fixtures compared to actually supine. Let's see. Supine start with the lower level of insertion torque and then going deeper and deeper. Top portion, taper portion gave us a higher insertion torque when, as you know, so it is a very important part, upper 1/3, right? Taper portion is important to get the higher initial insertion torque, right? But this Bright system, from the middle portion, gave us a stable insertion torque. It is very stable from this middle part of implant fixture, and then they almost have some flexure, and then the same level with a stable situation. It means, I think this kind of Bright implant system is a best combination with digital guided surgery, right? Yeah, I think artery, the artery ruptured. Small artery ruptured. But not excessive bleeding on this surgery field. So he is going to proceed a procedure of this surgery. Okay. This procedure is one of the effort for primary closure, right? So he makes some connective tissue from the inner portion of prep, and then make a pedicle and rotate to mesial part. Okay. During this procedure, maybe some arteries are scratched, so a little bit. Yeah. Okay, a little bit more. The bleedings due to but fortunately now all the bleeding is stopped. Okay, so he is connected with the healing abutment with the previous already installed, the old one. He got the two new implant installation today. First one is NTI tissue level. First one is a smaller diameter bone level implant on number 24 instead of NTI tissue level implant. Another one is number 27 area, wider diameter, 50 diameter, 7 millimeter with lateral approach, sinus augmentation by lateral approach. As you can see, number 24 area is very difficult to get the initial stability, so he got the many efforts. He make many efforts to get the better position to get insertion, enough insertion torque. So now he is trying to flap closer. Okay.
괜찮으세요? 거의 다 이제 왼쪽 위에는 거의 끝나갑니다. 예, 거즈를 다시 바꿔서 이제 6제로로 해볼까요? 6제로 한번 줘봐요. 거의 다 끝났습니다. 괜찮으세요? 예. 그리고 왼쪽은 밑에는 금방 끝날 거거든요. 예.
Okay, now he want to make another suture with 6-0, very thin suture. As you know, this thin suture material make a smaller scar. So actually, after healing, we cannot see any scars when we use this kind of 6-0 suture, right? So the smaller suture materials make lesser trauma of tissue. It means better healing and minimize scar, right? So okay, so he want to use another pin for fix of flap instead of suturing. Yeah, it is another the clever trying to flap closer, flap closed by suture generally, but Dr. Zhang preferred to use this kind of pin fix of overlying flap. Okay, they're almost done around this area. Okay, so checking around this posterior portion, I think I need one or two more stitch for flap closure. Okay, now he is using the 6-0 suture, maybe smaller suture, and continuous cross suture is applied for a secure of flap closing. Okay. So when we use this pin for fixation of membrane or this flap, we have to use this pin on only normal bone area. It means should be avoided. Usage of pin should be avoided on neighbor tooth root area or some implant installed area, right? Should be avoided. the only pin should be placed to the natural bone, right? Okay, so is this a good answer for your question, Dr. Ahmed from India?
왼쪽이는 끝났습니다, 선생님.
Okay, upper left area, the surgery procedures I have done. Good. Basically, a tough situation, as you can see, I already mentioned before, number 25 area, the bum crater-like big defect. It is very difficult to manage. So, yeah, the ordinary peri-implantitis, the late failure areas make a big defect. Looks like the same as this patient case. Right? So it is very difficult to manage, the proper prep manage and the proper the GBR procedure. Anyway, successfully all these upper left area, the procedures to have done. Okay, so moving to lower left jaw, number 37 area. Okay, he is using this trapine drill. The higher RPM, around the 1200 or the 1500 the RPM with the trapine here. The upper bone area should be removed. Can be removed. I think Dr. Zhang should use this. Should use elevator for removing this failed implant.
예, 엘리베이팅 하기 전에 이걸 아니 괜찮아요.
Oh, a clever idea.
스트라가 슈퍼라인하고 호환이 돼서요.
Okay, I see.
앵글드 엘리베이터가 있으면 더 좋고.
Yeah, he want to use angled elevator. The easier handling the elevator. The first one, to connect with healing abutment to implant fixture. Oh, yeah, very nice, very simple. Yeah, already installed. This failed implant was Astra, right? So Astra connection is comparable to the supine system. So Dr. Zhang connect the healing abutment to the already failed Astra fixture, and then try to luxation using the elevator and forceps. Wow, very simple. Yeah. The implant was removed from this number 37 area. Okay. Yeah, good idea. Before elevating, first connect with the healing abutment from failed implant, and then elevating for luxation. Yeah, it's good idea. They're very clever, very smart. It means the promote easy handle of elevating to remove the previous failed implant. Fortunately, this failed implant was Astra. So Astra type internal connection 11 degrees comparable with the dentin supine system. So the supine healing abutment will connect
그 제거한 압차도 별로 안
First,
좋거든요. 그래서
and then
지켜봐야 될 것 같아요.
the elevating for fully displacement of implant fixture, right? Very simple. First, higher RPM with the trapine, and then connect healing and elevating relaxation, and remove it. That's it. A very simple procedure. So, if I have a chance to this kind of a removing case, that I want to try the same method as Dr. Zhang's. Okay.
아, 보세요. 이제 왼쪽도 잘 끝났습니다, 선생님.
Okay. They have done the left lower left jaw. So, generally speaking, this area, just leave it, remove and suture and leave it during 4-5 months, and then after that, try again for another new implant placement, right? So you don't need any more like a bone grafting. You don't need. It is not necessary to any other procedure. Just remove and then leave it. And then stay there with 4 months, during 4-5 months, and then try again to install another brand new implant fixture, right? Okay, so
오늘은 왼쪽까지만 하죠, 선생님. 여기 생각보다 좀 어려워가지고요. 이렇게 하고 오른쪽
yeah.
다음에 한번 그 상황을 더 봤어요.
Dr. Lustam, thank you for joining, and also thank you for your good comment about this surgery. Thank you very much, Dr. Lustam. Okay, so Dr. Zhang finished today's surgery procedure. Upper left to implant installation with sinus augmentation by a lateral approach, and the big defect covered by bone grafting with a GBR procedure. Okay, I will be back in 5 minutes after the break time. Thank you for watching. Okay, let's see the panoramic view of today's surgery. As you can see, number 24 area, 3.5 diameter, 9 millimeter, brand new system, bright system, bone level implant system was installed. And number 27 area, 50 diameter, 7 millimeter length, also the same bright implant system was installed with sinus augmentation by lateral approach. As you can see, first, actually Dr. Zhang tried to get number 24 area with the NTI tissue level implant installation. He tried first, but it is impossible to get enough insertion torque cause of tissue level have some disadvantages when like this kind of big defect area. So he is going to change implant system. So finally, he decided to use this bright bone level implant system, slightly deep insertion. So when he decided to deep insert with the bone level implant, he used high-speed bar. When we use high-speed bar, we have to consider and pay attention about emphysema, right? So anyway, today's surgery is the successfully was done, even though the very big defect, the bombing crater-like big defect, the neighbor area. And the number 25 GBR procedures was successfully done, as you can see, with osteon 3 particulated graft material with collagen membrane. This area, even though big defect, but a 3-well defect, so maybe in future bone qualities and volume will be enough to enable the implant installation. And also 27 is a tough situation with the septum and the accessibility, poor accessibility and visibility. But even though this poor and tough situation, Dr. Zhang has done very nice sinus augmentation with implant installation simultaneously. So today's surgery will be very nice, was done very nice by Dr. Zhang, and also the remove the lower number 37 area, very simple and clever the method, connect with the healing abutment before the elevating. Okay, thank you for joining and watching today's live surgery show by Dr. Zhang using this bright system. And Dentium company have next live surgery on this year, actually this month, November 20, the same day and same time, Friday, same time, 7 o'clock. Okay, see you then. See you next time. Thank you. Bye.